For the first time in Wales, we are initiating this pilot project called Speedboat ESD. ESD is endoscopic submucosal dissection. ESD is a technique where we target large polyps to remove it in one single block rather than chipping it into multiple chunks, or the alternative to this technique would be surgery where the patient loses a part of this bowel to take this large polyp. However, with the introduction of Speedboat device, which is a newer technique and relatively safer technique, which combines both cautery as well as knife in one device, makes it a bit more easier and safer, and the learning trajectory easier compared to the traditional ESD. So from the patient point of view, this is a very minimally invasive, safe technique. From the healthcare point of view, this is definitely an advancement towards endoscopic advancement.
ESD is a technique that's traditionally been learnt over many years, where doctors go on clinical fellowships to countries such as Japan. The new device is a very safe device, and it enables practitioners which are already skilled in polypectomy to be able to learn this technique in a safe way that doesn't involve going abroad for a long time to learn it. Previous devices would have involved taking the device out and putting a new device in for separate functions, but this can both be done on the one device, which is pretty revolutionary, and it's better for the patient and it's safer for the patient as well. Going forward, we're hoping to do more and more cases, and it should really improve outcomes for patients in Aneurin Bevan Health Board, so they don't have to be referred elsewhere for this, or indeed have to undergo major surgery to remove a polyp.
Patient outcomes are greatly improved from doing the Speedboat procedure. Our recent case that we did, our first case, the lady went home after 2 hours in recovery. Usually the procedure that she would be done in main theatres under a GA would take in 3 bed days. So the patient came in on the morning of the procedure and went home on the same day. To come in the same day of the procedure, to have the procedure done, to be discharged within 2 hours of recovery, to just benefit from the facilities we have here at the Gwent. Again, to be sort of the first in Wales to do this procedure is something that we're very proud of, working with Creo and our consultants.